guys, welcome back. If you are new to the channel, my name's Mary and I post videos about nursing school. I can't tell you exactly what to expect from your programs because everyone's a little different, but I'm having a ton of fun sharing my experiences. Right now we're talking about first semester, so you can look forward to things that you might see in the beginning of your programs, and today we're talking about OR clinicals. So what I've learned from OR clinicals is that you can either have a super awesome, interesting day or you can have a really boring day depending on your attitude. So nurses in the OR will work 4 10-hour shifts instead of the typical 3 12-hour shifts. And obviously that changes depending on your hospital. But the ones I've seen have always done 4 10s, and so you'll have a little bit of a later start for your clinical, which is awesome because you get to sleep a little bit. And so they'll usually start around 6:30 and go till around 4:30. It really just depends on which surgeries are scheduled that day. So if they only have like 2 or 3 surgeries, you might be out of there by 1 or 2. It really just depends. And if you're in a smaller hospital, more rural, like the one here in my town, you'll probably get done sooner than if you're at a bigger hospital because they're going to constantly have surgeries going. Our hospital is actually so small that we had to call the day before and make sure that they even had surgery scheduled for us to watch. So we had to make sure they had enough room for the students that were scheduled that day. So that may happen in your case. Hopefully not. Hopefully you'll get to show up and just be able to learn everything that they're doing that day, but that might happen to you. When you show up to your clinical, you'll typically meet your professor either outside of the OR or at the front of the hospital because they need to walk you back to where you can change. OR nurses have to wear these green scrubs that the hospital provides, and they have to wear a hairnet and booties. So don't show up with any jewelry or like hair bows or watches. Any accessories have to be off your body in the OR. And another thing to note is that you can't have any like undershirts under your green scrubs either. So I will typically wear like a long sleeve shirt, like black or white shirt under my scrubs when it gets cold, but you can't wear those. They do have green scrub jackets because it gets cold in the OR. But that's just something I didn't really know at first, had to ask the nurses. So just so you know, no jewelry, no accessories, no undershirts. You'll go, you'll change, you'll get to wear your own shoes, you just have to wear coverings over them. And I do suggest having your hair in like a low bun or something because hair, like ponytails, look a little strange in the hairnets. That's if you care about that. You really don't have to worry about that if you don't want to. So I showed you in my last video what I would like bring to my clinical. I bring my stethoscope, I bring a notepad and a pen and my phone and all that. And so I would change into my green scrubs and be like, well, what do I do with all this stuff I normally like have on myself during clinical? And so there's no use bringing your stethoscope. You don't have to. You can bring your papers in there. The scrub jackets will typically have like pockets for you, and the nurses and stuff have like phones and stuff in their pocket, and so it's totally okay to have that stuff in your pocket. You'll want a pen and a paper to write things down if that's part of like an assignment you have due at the end of the clinical. You also can have your phone on you, but I would just say be a good student, keep it in your locker, because you don't want to look like a bad student in the middle of an OR. Like, you should be paying attention to the surgery going on and observing what your nurse is doing. So what typically happens is you'll get assigned to a specific OR room, and each room kind of deals with different types of surgeries. So one will be like ortho, so like total knees, total hips, those bone surgeries. Another will be general surgeries like gallbladders and appendix. Another will be, I don't know, little like carpal tunnel surgeries, little bone fracture surgeries. Another can be the gyno room, so any OB gynecological surgeries will be in there. Another one can be neuro. Another one can be heart surgeries. It really just depends on how big your hospital is. Ours in town only has 3 rooms, so they kind of like share roles in there, but I think the bigger hospitals definitely have specific rooms for each specific type of surgery. And they don't always let students in every single type. I know our ortho guy is very picky about when he has students or not, and I know in the bigger hospitals, like, they probably won't let students in open heart surgeries. So if you get let in one of those, that is way cool. So I'm just going to walk you through what my typical day with an OR nurse has looked like. So I got there, I changed, and I got assigned to my nurse, and we go straight to the AccuDose and just get any medications that we're going to need for the surgery. And it's not very much. Typically it's just the numbing medication that they're going to use, like lidocaine or bupivacaine, anything like that. There aren't that many meds that you're going to have to get. So you grab those, put them in the OR, and then you go visit your patient. So the patient before surgery is in pre-op, in same-day surgery typically, and they're going to visit with the OR nurse, the surgeon, and the anesthesiologist before they go back to the OR. And so the OR nurse's responsibility is to make sure that everything that needs to be done with the patient before they go to the OR has been done. So typically the pre-op nurse from same day is going to get the stuff done. We're just there to like verify that it's done correctly and that they're ready for surgery. So we're checking to make sure that they don't have any jewelry, that they don't have any dentures in, that they're not allergic to anything that they're going to be given today in the OR, that they're given all their pre-op medication so they won't feel like crap afterwards, and that all the consent forms are signed and they've seen the surgeon and the anesthesiologist. So once that's all done, their IV's good, we take them back to the room, we put a hairnet on them, we roll them back to the OR, and once there, we just set it all up, we place them on the OR bed, which is different, so you just have to transfer them over, and then you're gonna chloroprep any of the incision areas while the anesthesiologist is basically knocking them out for the surgery. So you get their incision all prepped up, and then the surgeon will walk in and you do something called a timeout. So a timeout is basically making sure that you have the right patient and you're doing the right surgery on the right site. So there have been times where they have the wrong patient in there, or they start to do a surgery and it's on the wrong leg, like it was supposed to be on the right leg, not the left. So the timeout is just to double, triple check that we're doing everything correctly. And so you do the timeout and then you just watch the surgery. And so a nurse's job during the surgery is to like chart everything that happens, because you need to know the time they start the surgery, any utensils they used, because the patient is charged by the minute. One of my nurses told me once that every single minute in the OR costs the patient $80, and they have to be charged for any of the utensils, instruments that they used, and anything that was left in their body. So like I had surgery on my ankle and there's a metal plate in my ankle and we had to pay for that. So you are in charge of making sure that everything is correct in the chart so that they're charged correctly. And it's also so that if something goes wrong afterwards, your butt is covered. Your butt is covered, all the other nurses in the room, they know exactly who was there, they know exactly what happened, so that if any legal issues happen, your chart is complete. Because if you forgot to chart something, oh, you're going to go down for it. Even if you did something right in real life, if it's not charted, it didn't happen. So a nurse's responsibility in the OR is very important. Your role as a student in the OR is to, number one, stay out of the way. They get really annoyed if you're in the way, especially the surgeons. They don't talk much. They show up, they do the surgery, and they leave. Like, they don't usually care about anyone else in the room. They've got a schedule that they're on, and they're trying to get patients in and out. So if you get an awesome surgeon that's like willing to educate you on things, that is way cool. They're awesome people. They just are on a schedule. So stay out of the way. Also, don't go near the sterile field. So you need to be like 3 feet away from the sterile field at all times. It makes it really hard to see the actual surgery. So laparoscopic surgeries are pretty cool to watch because you can just watch like on the screen that they have above and you get to see what's going on. But other than that, you can't really see everything in a surgery because the site's usually pretty small and the surgeon's like over the top of it. So it is really hard. And some people are fine with you hovering over them, like trying to watch, but others are kind of annoyed by it. So definitely read the room, see if your OR nurse is like more lenient on things and if they're willing to like teach you and let you be up close, because some are very stingy and like, get back in the corner, what are you doing up here? So definitely read the room. You'll get different types of nurses and different types of surgeons. So I have had a couple of pretty cool anesthesiologists that let me stand up by the head by them, and they would show me like what their job was, because you can be a nurse anesthetist too. And so that might be something that you might end up doing in the future. So if that's something you're looking into, definitely ask the anesthesiologist if you could stand up there and watch what they're doing. It's definitely a day where you just kind of watch and learn and get in as much as you can. So go in expecting to be standing all day and that you might not be able to get very much done. So just if you go in with that attitude that, okay, this is cool, I get to watch surgeries, it's a privilege that they're letting me in this OR, and I'm just gonna learn as much as I can, and if I can't see much, I can't see much. So just like expect that so that you're not disappointed at the end of the day. Also expect that your back is gonna hurt and your heels because you're gonna be standing a lot, especially if you're doing a full 10-hour shift. It's long. So my first semester, I had an OR clinical in the general room. I was only there for like 4 hours, so it was pretty quick. I saw a couple of gallbladder removals and a couple of hernia repairs, and it was my first time ever in an OR. It was actually my first clinical ever. So I was in there, my nurse saw me on my tippy toes, like trying to watch surgery, and he went and got me a stool to stand on, and it was super cool. The anesthesiologist taught me a bunch of stuff. Like, I had a great day. And I walked out of there like, yeah, I want to be an OR nurse. This is awesome. Second semester, I had a second day in the OR, but it was a 10-hour shift. So I was there all day. I was assigned to the carpal tunnel room, so we were just doing like carpal tunnel surgeries all day long. And it was just one after the other after the other. I couldn't see very much, and I didn't feel like I was doing very much either. I was just standing there. I don't know. I just decided after that day that I wanted to be able to help my patients more than that. But that being said, an OR nurse's responsibilities are very, very important, and so I'm not saying that OR nurses don't do much. They do. I just want to be more hands-on than that. So that was the decision I made after that day, that I probably don't want to be an OR nurse, but an OR clinical is definitely something that I hope all of you get to see. Like, again, that first day, I was just like mind blown, like so happy I was there. So I hope you guys get to go. If you do, if you've been already, leave a comment down below. I want to know your experiences. I hope you guys have a great week, and I will see you guys on Sunday.